Sterile dressing change, take 3. Okay, first I'd verify the order for a sterile dressing change. Then I'd gather my supplies. I have sterile gloves. I have clean gloves. I have my absorbent pad right here. And I have this towel is going to be my sterile drape. In here I have my sterile scissors and my sterile forceps. I have my measuring tape. I have my sterile cotton tipped swabs. I have my Lotiform. I have my Curlex. I have my 4x4. And I have my ABD pad with tape. Alright, so the banana here is my patient. As you can see, there's a hole in him, and the whole sticker area represents the wound. I got this idea from you guys, and I liked it, so I figured I'd try it. I figured it'd make it easier. Next, I'm going to perform hand hygiene. And after I do that, I'm going to pull the curtain and provide privacy for my patient, and then I'm going to perform aid it. I'm going to ask the client for their name, 2 patient identifiers, their name and birthday. And I'm going to introduce myself. Hi, my name is Joshua. I'll be your student nurse for today. I'm here to do a sterile dressing change. And it should only take about 10 minutes. I would thank them for their time. I would assess their pain. And if they're in any pain, I would administer some medication at least 20 minutes prior to doing this dressing change. I have my trash can here right next to me. Next, I would raise the patient's bed to a comfortable working position, and I would assist the client to a comfortable position that would provide me easy access to the wound. I would perform hand hygiene, and I would don clean gloves. And this is to remove the soiled dressing. So in this case, I don't have the soiled dressing on here, but I would put on clean gloves after hand hygiene, and I would remove parts of the dressing. And if anything's sticking, I would use a sterile saline to loosen and or remove the old bandage. I would note the presence of any odors. I would note any amount or type of drainage. I would note how soiled the dressing is, and then I would place it all in my trash can. Then I would assess the wound, and I would check out its appearance. I would see if there's any granulated tissue, any tunneling or drainage. I would look at the surrounding tissues around it. And then I would measure the wound length, width, and depth. So by doing that, you would take the tape measure. And the wound is approximately 1.5 inches in length. Approximately 1 inch in width. And then depth would be measured with cotton swab. It would be placed in here into the wound to see if there's any tunneling. And then I would measure it. And that appears to be 1/2 inch. So after I measure, I'm going to remove my clean gloves and perform hand hygiene. Then I'm going to prepare my sterile field. I'm going to open my sterile supplies onto my sterile drape here, which first I'm going to start off with opening my scissors and forceps away from me onto the dressing. The cotton tipped applicator. The 4x4 pad. I think that's it for the sterile field for right now. I know the loader form goes on there, but I don't have my gloves on first of all to do it at the moment. So I'm going to don sterile gloves. Come on. Alright, can't seem to find the thumb hole here.
Stop it.
Okay. So after I don sterile gloves, I'm going to clean the wound with the swab, working my way out and away from the wound to not put any microbes or bacteria into the wound. Next, I'd take the lotiform and my forceps and I would get enough to pack it into the wound.
Well, I've been wanting to do for such a long time, and there's something I've always wanted to tell you if I ever got a chance to meet you.
Alright, then I'm going to apply the 4x4 gauze and remove my sterile gloves. And normally I would remove these a different way, but I'm trying to save them for future use. Oh, come on. And then I perform hand hygiene.